Hello everyone and welcome to another episode of Wing It Med. So we're going to talk about anatomy of the brain and cranial cavity as seen in CT. I'm going to divide this into two parts. The first section is going to deal with the contents of the cranial cavity excepting the brain parenchyma, and part two is going to deal with the CSF spaces and with brain parenchymal structures including the gray matter and white matter structures. So without further ado, let's dive into the topic. Okay, so first things first, let's talk about sutures. If you remember, the calvaria is developed from 7 individual bones, one frontal, one occipital, and a pair each of parietal and temporal bones. In intrauterine life and the early part of infancy, these bones are separated by membranous tissue, the fontanelles, which later on fuse, and these junctions are nothing but the sutures. So in essence, sutures are nothing but fibrous joints. So every bone has a cortex and a medulla. In the case of skull bones, these individual bones have the outer and inner tables, and in between is the medulla, which is the diploid. So even in a joint, the cortex is still intact. So in this case, we have the outer and inner table. You can see that the cortex extends into the suture. So because they're individual bones and it's a joint, the cortex is still intact. So one thing you must remember in identifying a suture is that the cortex extends into the suture. Also, a suture is never a straight line. It is always jagged. So if you look right here, you can see that it has this jagged pattern. So in summary, two things which you must remember to identify a suture is that one, it has a jagged pattern, and two, the cortex extends into the suture. Okay, so first let me draw your attention to the image to the right. So here we have the lambdoid suture on either side. So you can see, as I described earlier, that the cortex invades into the suture. Now to better understand this, let me direct your attention to the image to the left. This happens to be a metopic suture. So if you remember from anatomy, when present, a metopic suture separates the two frontal bones. So if you look at the metopic suture right here, you can see, as I described earlier, that the cortex dips into the suture on either side. Let me clear that. And what is most striking is that the suture is jagged. It's not a straight line. Okay, so here we have a metopic suture. Those of you who had this reaction, congratulations. The others, please go back and watch the suture slide again. So in accordance with what I said before, we can see the outer table here. Excuse me, let me change that. Yes, so the outer table here, inner table here. But you would notice that the white cortex does not extend into this. And as I had said earlier, a suture is supposed to be jagged, while this is straight all through. So let me clear that so you can have a better look. You can see this bulge right here. So that happens to be a scalp hematoma. So this is a fracture. Okay, so just to summarize, the cortex extends into the suture and the suture forms a jagged pattern over here. While a fracture, on the other hand, is straight, and at the same time, let me clear this again, it's obvious that the cortex ends here. It does not extend into the suture as it has over here. Okay, so now it's time to dig into the base of the skull. So we have these two pointy structures over here, which happen to be the lesser wing of sphenoid. So let me clear that. Let me direct your attention now to these two faults in the bone And to refresh your knowledge, notice that the cortex does indeed extend into these faults, and they are not straight but have a jagged pattern to them, and they are thus sutures, and in this particular case they happen to be the coronal suture. Right. So based on two landmarks, the cranial fossa can be divided into three parts. So one of the landmarks being the lesser wing, which we just talked about, and the other being the petrous temporal bone, so indicated by the mastoid air cells. If you remember from the first video, we used the mastoid air cells to orient anterior and posterior. Right. So this divides the cranial fossa into three: the anterior cranial fossa, the middle and posterior cranial fossae. So just to refresh your anatomy, the anterior cranial fossa contains part of the frontal bone, the frontal lobe. The middle cranial fossa contains the temporal lobe, and the posterior cranial fossa houses the cerebellum. Right, so we have one last structure right here. Yeehaw! Those of you still scratching your heads, this is the sella turcica. The word sella turcica stems from the Turkish saddle. So that houses the pituitary fossa. So let me just clear this quickly. And we have the anterior cranial fossa, the middle cranial fossa, and the posterior cranial fossa. And right up center, we have the pituitary fossa. Okay then, so now let's talk about another set of important structures which we can see in CT, which are the sinuses. So let's begin with the frontal sinus, which we can see right here. It's my favorite sinus. The main reason being my sister doesn't have one, so I can call it thick-headed and get away with it. Also because the frontal sinus is said to be unique to an individual. So just like how a fingerprint is individual to us, and it's a fact that even among identical twins, the fingerprints are not the same. This is also the case when it comes to the frontal sinuses. Okay, so as I said earlier, the frontal sinus is unique to the individual, and so don't be taken aback if you see varied patterns of the frontal sinus. So if you see here, we have multiple septations within the frontal sinus. You have three cavities here, and there's a huge cavity over here. So the pattern varies, and as I said earlier, in the case of my sister and around 5% of the adult population, the frontal sinus does not generate. So that's called a frontal sinus agenesis. Okay then, so next in line is the maxillary sinus. So this is an image from the first video. I don't know if most of you noticed, but there seems to be an asymmetry over here. So this is the maxillary sinus on the left side, and this is it on the right side. So if you notice, the cavity of the maxillary sinus is reduced on the right side. So this is a result of mucus hyperplasia, and it is a common incidental finding. It usually doesn't cause that much of issues except of coryzal symptoms. Okay, so here we'll talk about the ethmoid and sphenoid sinuses. So if you remember from anatomy, the ethmoid bone contains within it three groups of ethmoidal cells. So we have them right here, one on each side. So the ethmoidal cells are divided into three groups: the anterior, the middle, and posterior ethmoidal cells. And right here is the sphenoid sinus. So let me clear all of that so we can talk about the sphenoid sinus. So once again, this is the sphenoid sinus right here. You can see here that it's septate. There is one septation, and just like how the frontal sinus can be a single cavity or multiple cavities, the sphenoid sinus can also be a single cavity or just septate with a single septation or with multiple septate. So as the name suggests, the sphenoid sinus is present within the sphenoid bone, and if you remember, the sphenoid bone forms part of the base of the skull. So if there were to be a fluid level in the sphenoid sinus, you ought to suspect a basal skull fracture. So when taking a CT, a patient is going to be lying down. So if there is indeed a fluid collection, it would collect at the base of the sphenoid sinus like this. Right. Okay, so just as a recap, so this is a coronal section in which we can see here the maxillary sinuses on either side. Here we have the frontal sinuses, and these are the ethmoidal sinuses over here, these on either side. And let me quickly select another color. So these are the nasal cavity. Right then, it's time to talk about meninges, which are the coverings of the brain. We have three of them: the dura mater, the arachnoid mater, and pyomater. So the pyomater is closely applied to the brain, while the dura and arachnoid are inseparable under normal circumstances and are directly applied to the bone. So we can not see the meninges in CT except under two circumstances. One is where they form specialized structures. We have uh, the dural structures, the fox cerebri, the fox cerebelli, and the tentorium cerebelli, all three of which are visible in CT. Or in pathological conditions, say there is an epidural hematoma, then we would be able to see the outlines of the dura. So the first structure we're going to see is the fox cerebri. If you look at this white structure right here at dead center, that is the fox cerebri. So as you all know, it separates the two lobes of the cerebrum, and this is very important in the context of CT in two conditions. The most important of these is the mass effect, which we'll be covering in future slides, and in the case of a meningioma. Okay then, so just a quick glance at mass effect before we move on. Mass effect is quite simple. Whenever there is a buildup of pressure within the cranial cavity, either because of hemorrhage or a tumor, the pressure within the cranial cavity isn't relieved as easily, and so there is a huge buildup which causes mechanical distortion of the contents of the cranial cavity. So all the structures within the cranial cavity are mangled, and we have several grades which we'll go into detail later on. What I wanted to see right here is that the fox cerebri, as you can see the white structure here, so let me remove that so you can visualize it. It was supposed to be straight like this, but it's gone kinked. Let me remove that again. Right, so this is in response to a subdural hematoma to the left. We will definitely deal with this later on. Just wanted you to see the fox. So up next we have the tentorium cerebelli, which separates the occipital lobe of the cerebrum from the cerebellum. So if you look right here, you can see this light halo of sorts. So that happens to be the tentorium cerebelli. Remove that, and on either side, so there's one over here and one over here. So it's like a sheet all over the cerebellum, but it's thickened at these portions, and so you can see it better. It's all over the cerebellum, but being thin, it's not evident. So this is important from a pathological point of view, because subdural or subarachnoid hemorrhages can track along these the tentorium cerebelli, in which case they would appear more white. Finally, it would serve us well to remember that the fox cerebri and the tentorium cerebelli are continuous with one another. So right here at the center we have the fox cerebri, and on either side the tentorium cerebelli, which is continuous with the fox cerebri. So let me clear that so you can have a better look. So right here you can see the geometry. That's it for the second episode of Wing It Med. Thank you all for tuning in, and you can expect a second tutorial pretty soon that will concentrate on the CSF spaces and the brain parenchymal anatomy. Thank you all.